Skills versus capacity. The first athlete that we're going to see has a skill issue. The stance of the feet, you can see that the athlete does not stand in one straight line. Therefore, the athlete shows a shift in the back squat. The athlete has to compensate for this. When we're looking at the athlete from the sagittal plane, we can really see what is going on. The feet of the athlete are slightly in pronation during the back squat. The athlete shows also excessive forward trunk lean and loses therefore the lumbar and sacrum region. The athlete is standing in a straight line to prevent the athlete from shifting again. We provided heel wedges to prevent forward trunk lean. In this shot you can see that the athlete does not shift anymore. Although we added the heel wedges, the athlete still shows that he can't control the lumbar and sacrum region. We used the rocking movement to see if the athlete could control the lumbar and sacrum region. The athlete can only control the lumbar and sacrum region to a degree of 79. We used the pole squat to assess the athlete if the athlete can come into a deep squat without losing the lumbar and sacrum region. This shows that the athlete can come into a deep squat position without losing their lumbar and sacrum region. The athlete has good hip and back disassociation. We used the hip flexion assessment to see if there were any constraints in the athlete. The athlete shows a good hip flexion of 90 degrees. There is a small difference on the left side of the athlete. The athlete shows a hip flexion of 82 degrees. To see if this really is correct, we tested it one more time. It still shows that there is a small difference to 82 degrees to 90. Now we're going to test the hip flexion with external rotation. We can see here that the athlete has good hip flexion. The athlete has a range of motion to 90 degrees. We're also going to check if the left side has any difference on external rotation. The left side shows that there is no difference in external rotation of the hip flexion. It achieves a degree of 90. We used the weight-bearing lunge test to see if there were any asymmetries in the ankle range of motion. The right ankle shows a degree of 72. The left ankle shows a degree of 72. There are no constraints. This athlete shows a capacity issue in the back squat. The athlete does not stand in a straight line. The stance of the feet are slightly outwards. When the athlete goes into the deep back squat, the right foot shifts slightly outwards and the athlete gives a left shift in the squat. The athlete tries to correct herself when she comes into the deep position. Her feet are slightly pronated. When the athlete goes into the concentric phase, you can see that the athlete goes immediately to the left shift again. The athlete stands in the left shift. Looking from the sagittal plane view, we can see that the athlete does not have excessive forward trunk lean, but the athlete does not come into the deep squats. You can see clearly that the feet are slightly outwards and that the athlete has to compensate. Her feet are really in a pronated position. We use the rocking movement to see if the athlete shows a good lumbar sacrum association. You can see that the athlete can hold her back in a good position. The athlete reaches a degree of 83. You can see that the athlete has a left shift to see if there were any asymmetries in the hip flexion. The athlete shows a hip flexion of 112 degrees. Shows again 112 degrees. We're going to check the left side and see if there are any asymmetries in the hip flexion. The athlete shows a degree of 113 in the left position. We're going to check the hip flexion with external rotation. The athlete shows a degree of 120 in the external rotation on the right. With external rotation on the left side one more time. It shows a massive asymmetry in the left hip. It shows a degree of 85. This may be due to her old low back injury. We are going to use the weight bearing lunge test to see if there are any asymmetries in ankle dorsiflexion. It shows a degree of 42 on this side, and we're going to check the other side. You can see here that the athlete loses the control, and we're going to see what the capacity is of the left side. The capacity range of motion, a degree of 37 on the left side. This is the difference. Here the athlete loses the range of motion. Use the pole squat to see if the athlete has good hip and back association, but you can see here that the athlete does not go further than this degree. The athlete does not go any further than 65 degrees. This is due to pain in her lower back. This athlete shows a capacity issue in the overhead barbell press. The athlete knows how to do the exercise, only the athlete does not have the mobility to perform the exercise well. Normal thoracic humeral rhythm is important for injury prevention. This is extremely important in overhead activities. When the athlete presses the barbell overhead, the athlete comes into a more kyphotic thoracospinal posture. No huge difference between the left and the right shoulder. We're going to see if there are differences between the left and the right shoulder when it's moving separately, but there is no difference. We're looking from the transverse plane, we can see that the right shoulder goes a lot further than the left shoulder. He is constricted in his mobility. In this mobility, we can see the shoulder flexion of the athlete, and we can clearly see that the right shoulder comes a lot further than his left shoulder. We're going to assess the internal rotation and extension and adduction of the shoulder. We can see here that the left shoulder goes a lot further than his right shoulder. So he has a deficiency. Also, we're going to check the external rotation and flexion and abduction of the shoulder. He does not show any asymmetries in this assessment. For the next test, we're going to use Yoakum's impingement test. This is for identifying rotator cuff impingements. The athlete does not show any signs of pain or constrictions. The other test is for pain provocation assessment, is to identify AC joint pathologies by athletes. The athlete does not experience any pain whatsoever. Looking from the sagittal plane at the athlete, we can see that the athlete has a neutral spine and a neutral posture. When we're looking from the transverse plane, we can see that the left side of the upper trapezius is slightly elevated. This may explain the mobility issue with the shoulder flexion exercise. The next athlete that we're going to see has a skill issue in the overhead press. The athlete has good range of motion. This is different than the athlete we have seen before who have mobility issues. We're going to look at shoulder flexion to see if she has any deficiencies that limited her in her range of motion. We're going to look how their shoulder moves on the right and the left side. The athlete does not show any range of motion issues. Now we can see from the sagittal plane if there are any mobility issues and if the athlete can hold a neutral spine and a good posture. The athlete has a good posture and is not compensating. The athlete shows normal thoracic humeral rhythm, and this is extremely important for injury prevention, as when we were pressing overhead activities. The next assessment is to assess internal rotation, extension, and abduction of the shoulder. As you can see, the athlete has no problems with her range of motion. The next assessment is to assess external rotation, flexion, and abduction of the shoulder. You can see the athlete does not have any problems with this assessment, as left and right is equal. The next assessment we're going to do is from Jeuken's impingement test and to test the AC joint pathologies. The athlete does not experience any pain as the athlete is laughing and is not in discomfort.